What's up, PT people? Back at it again. This time we have a more general article review, stepping away from baseball specific and going with an overhead athlete article. The title of today's article is Comparison of Shoulder Range of Motion, Strength, and Upper Quarter Dynamic Balance Between NCAA Division I overhead athletes with and without a history of shoulder injury. The author is Kim Y. There were 58 overhead athletes who were fully participating in NCAA Division I overhead sports, including baseball, softball, volleyball, and tennis. All were free of any current shoulder injury. Participants were divided into shoulder injury history groups, including 25, and uninjured history group, 33. Participants in the shoulder injury history group had a previously resolved shoulder injury. Main outcome measures: active range of motion assessment for shoulder internal rotation, external rotation, and horizontal adduction. Isometric strength assessments for shoulder internal and external rotation, and the upper quarter Y balance test. The description of the upper quarter Y balance test at sralab.org is: it places a patient in a closed chain push-up position and tests their ability to maintain that position while reaching with one hand in 3 test directions. They include a medial reach, inferolateral reach, and superolateral reach, as far as possible during the entirety of the movements. Results: the shoulder injury history group demonstrated a lower upper quarter Y balance test mean score in the superolateral direction, which would be that overhead position that these athletes often find themselves in within their sport. No group differences existed for the other results. Conclusions: overhead athletes with a history of shoulder injury had worse upper quarter dynamic balance versus those without the history. From a clinical perspective, the findings may have significant implications for developing shoulder re-injury prevention and rehabilitation protocols in relation to their shoulder injury history. This test is shown to have excellent retest reliability, as well as inter and intra-rater reliability. So if you're not already using it with your overhead athletes, it may be a good baseline test for you to incorporate now. Click the like button below if you enjoyed this episode, and hit the subscribe button to stay up to date with more articles coming out in the future. Have a good one.